leave your comments in the chat box as well. And hey, looking forward to having a very, very impactful discussion this morning. So before we jump in, let's kind of set the stage here. When we talk about dementia, many people think it's just about forgetting things, but it's so much more than that, really and truly. Because you can say it's not a single disease or ailment or condition, but an umbrella term for various conditions that will probably affect memory and so on and so forth. But Dr. Busayo, when one hears the word dementia, what should actually come to their mind? What should they understand? And from your experience, at least here in Nigeria, what are you seeing in terms of how common this condition is? You're muted, Dr. Busayo, in case you didn't know.
Okay, thank you, Mr. Ayokunmii. All right, so when you hear dementia, the thing is, what I found is that most people actually know, the prominent and major symptom of dementia. Everybody says when they know that somebody starts forgetting things, it's at least a number of Nigerians I know that they know that they even come to the hospital telling you, I think she has dementia. This is not from research. This is just from clinical practice and observation. However, dementia, just like Mr. Ayokunmii started and was trying to clarify, dementia is not just a single disease, it's actually a syndrome. Syndrome means a group of symptoms, that affect memory, thinking, behavior, basically. And it's not when it becomes problematic is when, it starts impacting the person's functioning. And another thing I need to quickly state here is that truly dementia is actually a disease of the old age, really. Really, yes, we have early onset dementia, but mainly dementia is something that you find after 60, 65 years old among the seniors. So
Okay.
it's not so when you hear people come down with dementia, it's only a few type of dementia that can come early. So so what happens is that the truth is when a person is getting older, there's something we call normal aging. There are some things that happen in normal aging that kind of typifies or looks like dementia. But the thing is, when this dementia it's a condition, it's a medical condition, and at this point, it's now becoming more progressive. It's more progressive. It's
Okay.
impacting their what we call activities of daily living, the basic ones. The person is not able to groom himself, the person is not able to feed, the person is not sleeping, because there are several things that can happen when a patient has dementia. And the other question you asked about I think is how to know, is that when you start noticing that this person is forgetting things, usually it starts with the memory of recent events. You told them something some few minutes ago, they can't remember, start forgetting faces, missing their way around the house. I understand what I'm saying. Now, when somebody is aging normally, what happens is that for the brain,
Yes.
the brain reduces in size, like the volume. The volume of the brain reduces, the brain shrinks.
Oh,
Yeah, the brain
okay.
shrinks, and there's something called the hippocampus memory that also shrinks. It reduces in size, and this is also similar to what happens in normal aging. Also, when a person is growing older, the brain shrinks and gets smaller. So it's normal for normal, elderly people, 60 and above, to forget things occasionally, but it's not always like persistent. It's not something that is consistent. Also, there's some the nerves in the brain. Some of them are being lost as we grow old, and this also happens in dementia. But how you differentiate it from normal aging is that in normal aging they won't lose their functioning. They will still be able to do other things that they were
Okay.
always doing, like taking their bath themselves. Because that's even the basic. At some point, they can't even manage money. You understand? They can't manage money. They can't drive. They lose, their advanced activities of daily living. So basically, that's the so in Nigeria. The truth is, because of our setting, a lot of research have not been done. But in Africa, there's some researchers are saying that about 4 to 10%, of people have dementia. So which is something that and because of the now life expectancy is increasing. The truth is that life expectancy, there's increased life expectancy, especially in Nigeria, and we're beginning to see that people are living, longer. Yes, by research we are seeing that. So and because of this, the dementia burden will be more. Dementia burden will be more. There'll be more people coming up with dementia. Yes. So there'll be, hello, can you hear me?
Huh. Interesting thoughts there. Okay, now I'm quite glad you mentioned that age is, let's say, the biggest risk factor, because you mentioned that those who are advanced in age, older people, are at the biggest risk of, should I say, contacting or contracting or dealing with dementia. Now, this is something that I want to know, and I'm pretty sure that a lot of people out there listening right now would want to know. Is dementia something that happens just with age, or are there things that we can actually do in order to protect ourselves? Talking about maybe our lifestyle, for those living in Lagos, for example, lifestyle, diet, stress levels, what we things we do on a day-to-day. How do these play into the risk of possibly dealing with dementia going forward? You're muted, Dr. Busayo.
Sorry about that. I was trying
It's
to,
it's
yeah, sorry
okay.
about it. So I just needed to clarify that even though um, age is one of the strongest risk factors for dementia, not everyone that will get old will develop dementia. Okay. So I just needed to
Okay.
clarify that. So your question again, I just want to get it again. You said, can you rephrase that question?
Okay, I was just asking that is there something that we can do to protect ourselves, looking at our lifestyle, diet, stress levels, social habits? Do these things play a part into the
Thank you.
possible
Thank you
risk?
very much. I was getting to that because the truth is there are different types of dementia. Commonest is what we call the Alzheimer's dementia, that is progressive, and there's something we call vascular dementia. Now, for the vascular dementia, it's a type of dementia that occurs when there's like low blood supply to the brain. Now, the things that can cause the low blood supply to the brain are things like hypertension or when we talk about stroke. Maybe when
Okay.
person really has the stroke or mini strokes, this can affect the blood supply to the brain, and then this can now lead to dementia. I don't know, maybe you understand what I'm saying. Now,
I
so
understand.
if when it comes to hypertension, diabetes, excessive alcoholism, smoking, and all that, these things are the risk factors for stroke. You understand? They are the risk factors for hypertension.
Okay.
So if we want to, there's this Lancet Commission for Dementia Prevention in 2020. They identified 12 modifiable risk factors. That means things that we can do on our own to prevent dementia. And it has been seen that this can help delay 40% of dementia cases globally. The thing is,
Wow.
once dementia has started, dementia is actually not curable. You just want to, delay the
Mm,
progression to the severe form of dementia. Okay. So the first thing when it comes to, talking about Lagos and everything, because Lagos is, it's a bustling city, fast moving. The major thing I see here is our diet. Is our diet.
aha.
Lagosians love spicy food, flavor. Food filled with love salt, high salt intake. And the thing is that when it comes to blacks and hypertension, one of the major things is high salt diet. So we have to be careful because most people that are selling all these snacks that will just pick up, put a lot of condiments, maggies, and salt, and this is not heart friendly. So our advice, rather than taking um, meals that have high salt, oil, and processed, you know, meals like flour. We need a heart healthy diet. We call it the Mediterranean diet. That's what I'm talking about,
Okay.
like low salt diet, the DASH diet. And then we should take things that are more with vegetables, fruits, all grains, proteins. We should take more of proteins, healthy fats, which is good for the what? For the brain. Because diets that are rich in, fries, red meat, sugary drinks, they will increase, you know, one's risk to hypertension, diabetes, and cholesterol, which are all now the risk factors for developing vascular dementia. So we should eat things like ugu, okra, nuts,
Mm.
fish, ekpa,
More,
and we
more
should reduce
vegetables.
more vegetables, and we should reduce fried snacks. And also, chronic stress can lead to other things like, fatigue, can even worsen high blood pressure, sleep, and also some studies are saying that it might affect brain inflammation, and this can also increase the risk for dementia. So, because when you are under chronic stress, what happens is that the cortisol level, sugar levels increases. That's for the stress
Okay.
hormone, and over
Okay.
time, this will also worsen I told you that the brain shrinks in dementia. So it will
Yes.
now allow the brain will now shrink more. And especially the part involving the memory. So we have to calm down, try to pause and relax. Also, isolation is not good. These people are so busy, they're unable to socialize meaningfully. Loneliness
Aha.
is Loneliness is becoming, a silent and recognizable risk for dementia. So let's encourage social interaction. Let's not lose that about communal living, checking up on one another, which because we are becoming westernized now, and we have to just be careful about that. Especially with this jackpot syndrome, everybody traveling. I fear for our elderly
Yes,
people.
so
Also, physical activity is very, very important. When it comes to inactivity, it's a major problem because sedentary lifestyle is sitting in traffic for hours when it comes to Lagos.
or
So you
sitting
have
in the
to,
office for hours, not
even
moving
yes,
around.
office, not moving around, even in traffic. So physical activity helps to improve blood, flow to the brain, and this supports the memory. And so we should aim for at least 30 minutes of movement. 5 days a week, you can dance, you can brisk walk, you can swim, you can run, you know. And for elderly
Right.
people, we're talking about gardening, just something little in the compound, just gardening, just move your body. Then also, we're talking when it comes to people that have hearing impairment, untreated hearing impairment actually doubles the risk of dementia. This is very key. When you notice that
Oh,
your an elderly person around you has hearing impairment, it doubles their risk for dementia. So we have to be careful. Smoking and poorly blood controlled um, blood pressure
all
are
right.
major risk factors too that we have to work on. So smoking is a no-no. And also when you have to take alcohol, very moderately. And if possible, no alcohol. Thank you.
All right. Thank you so much for that, Dr. Basayo. We'll take a very quick break when we come and then come back in. For those who like to form, I'm an introvert. I like to stay on my own. As you've heard, Dr. Basayo said, you need to socialize, leave your house, go outside, meet people. Don't be forming, I'm going to stay on my own all the time. It's not healthy for you at the end of the day. All right, let's take that break right now. When we come back in, we'll be taking a look at the cultural and social impact where dementia is concerned. This is Lagos Talks here on the Smooth Breakfast on Smooth 98.1. Keep it tuned. Huh. Interesting thoughts. I had no idea that there were so many things that could lead to dementia. Even ear infections. Wow.
I said hearing impairment, yes, hearing loss.
Ah, now, wow. Huh.
Yes. Yes.
That
Yeah.
is that is serious. I'm glad you talked about diet and physical activity. That diet of a thing, it's a big issue. It's a
It's
big
a big
issue.
issue. Now that things are quite expensive, it's actually a big
Mm,
issue. It is a big issue. It's a big issue. But we just have to find a way around it.
one
Because
way or another.
eating, yes, so we have to find a way around it,
Yes,
because
definitely. One way or another, we have to.
when people know, I'm so happy with Smooth FM for doing this because the first thing is about the knowledge. There's a lot of knowledge gap about these things, and it's very difficult to take a people, away from their belief. It's difficult to change, the belief system. But when they keep hearing it, it can help them to, shift a bit, even if they don't totally agree with you. But at least they will do what you advise them to do if it pertains to their health.
True. Very, very true. We keep it moving. We keep it moving. Okay, we're almost back in. And we're back. Lagos Talks on the Smooth Breakfast here on Smooth 98.1. Love music, love life, love great conversation as well. And that is what we are up to this morning, having great conversation, talking about something really important, and that is understanding or better understanding dementia. It has been quite an interesting morning so far. And I've been having this conversation um, with Dr. Oluwabusayo Fagbo. She is a mental health specialist. She's here to give us a better understanding, break any necessary tables that need to be broken, and of course, bust any myths as well. Because Nigeria and health issues, we tend to have a lot of myths and or beliefs as well. You can share any of those probable beliefs you have, and let's see if you are on the right path or not, or any questions or anything that you'd want clarity on where this issue is concerned. Please send a message in to us on WhatsApp on 0809 444 0981. 0809 444 0981 is the WhatsApp number. We're also on YouTube. We're streaming live at Smooth 981 FM Lagos. Smooth 981 FM Lagos. There's a message here from Cisco Delgado, and he says, he says, the other day I wanted to get a cup to have coffee, and as I went into the kitchen, I began to ask myself, why am I here? It took me almost 10 minutes to actually realize, oh, I came to get a cup. I hope I'm not suffering from dementia. Cisco, I don't think you are, the ripe age for that yet. I want to believe that you're still a very young and agile man. So I'm not sure that's what it is. He also says social activities are very important and good, but the way the country is now, most people refrain from such due to insecurities. Dr. Busaya, when you talk about social activities, does it always mean, oh, you need to go to this particular place or go to a party and so on? I mean, you don't need to do anything so out of the ordinary to be social. Am I correct?
Yes, when it comes to social activity and then mingling with people, I'm not saying that you have to always go out. I mean, it depends on first even the money that you have. But when it comes,
Mm,
even I'm talking about even within your neighborhood, who are your friends? Most of us live. You don't even talk to your neighbors. What I mean, it's as small as having like a weekend, a weekend interaction with your neighbors, playing football, in the estate, things that are as little as that. And for in the religious settings, going to those church fellowships, church programs, those Christian fellowships, they have this dancing where they move their body, and then joining
mm,
those groups, social interaction, having those meetings, going for those and occasionally. It's very important because I don't think that the security. I'm not saying you should go out late in the night. I'm not saying you should, everything has a limit. I'm not saying you should, go for clubbing and come back home by 2 p.m. and 2 a.m. and all that. No, no, no. I'm talking about start with, those little things. Some people we have even siblings within this Lagos and they don't visit one another. It's about, putting it as something important in your mind. In my adage, they say things like when you love somebody or when you love something, you always make time for it. So now that you know
definitely.
that this is very important, because now, especially with the issue of phone addiction, I did a video on phone addiction on my Instagram page, Dr. Busayo Mind Bomb, and it's bad. People just want to be with their phone, and they've lost. We are losing even in families, fathers and their children, husbands and wives. We are losing this, interaction with ourselves
Mm,
just because we are so addicted to our phone. Everything is on the media, and then this will eventually progress to loneliness, which can also, it continues to go on and on. Like, so let's just interact with one another, within the estate,
right.
within the streets. So those are the kind of
Mm.
interactions I'm talking about, not, something so big as, you have to go to those expensive clubs and all that. No. All right.
Uh, and in fact, what you just said now is something that Stan sent a message to actually ask about. It seems like you were in Stan's mind as you said what you just said. He says, how true is it that too much time on the phone can cause forgetfulness or partial dementia?
That's that.
Are you there, Dr. Bzaya?
Hello, can you hear me?
Okay, yes, I can hear you now. Did you hear the
Okay,
question?
sorry. Yes, I heard the question. I said I guess I started answering the question already. And,
Exactly.
and most of the things that I'm talking about is, it's because, staying on the phone isolates you. It becomes addictive. You see, the same you smoke this psychoactive substance like cannabis, you know, is that there's increased dopamine, which feels
Mm,
so good. It's a feel good hormone. And, you know, when you like have sex, you have like, let's say, 200 units. When you eat, you have like 150 units. But when you smoke cannabis, you have like 1,250 at once. So you can see
whoa.
the reason why. So that when people get into taking psychoactive substance, they don't even care about girlfriends and all those things. Now, it's the same thing that is now happening with any form of addiction. You just continue to scroll on your phone. You don't need anybody. You're isolating yourself. You're not
Mm,
communicating. And because one of the things that are that we found from research to prevent dementia is reading helps the cognitive reserve. That's why we are saying we don't want people below the secondary school education, and even if you are above, we have found that reading continuous education and all that, it helps to prevent the onset of dementia in most people. So while screen
Definitely.
might not directly cause dementia, it can lead to things that can, cause dementia. So that's just it by and large.
All right. So, Stan, you need to stay off your phone a whole lot more. I mean, it won't directly be a cause, but it's definitely part of the issues. Okay, Dr. Busai, let's talk about something very real in our society as we know it now. This is the stigma around things like dementia. Now, how does our cultural understanding, sometimes work against families who are dealing with this condition?
Thank you very much, Ayokunmii. The truth is that we are a very cultural people. And when I say
Yes.
culture, it's not just the culture like, oh, where are you from, maybe tribes and all that. Even we are kind of divided in different ways. Even we have religions, different religions, and it's there. So you see, dementia is not just a medical condition. Sometimes it can be misinterpreted through the lens of culture, religion, and our beliefs. And this misunderstanding can lead to stigma, and this stigma will affect them even coming out for saying that, oh, something is really wrong. It will affect diagnosis, it will affect support, and it will affect care. So now, because there are a lot of misconceptions about dementia. Take for instance, there's some myths that people have about it. So when people have dementia in all those villages and everywhere, they start calling them that they start saying things like they are witches, they have a witchcraft attack, or it's a spiritual attack, or some just say it's just old age. And then the one that is common that I hear the relatives say, Mama is just too stubborn. Baba is just too stubborn. They think that the person is just too, some people just think that it is a repayment for bad behavior or that they are showing what they've reaped. These are the things, because one of them, the way apart from the undue forgetfulness, the other symptoms
Yeah.
that come with dementia is that sometimes they have, we have what we call behavioral and psychological symptoms. And this can span from depressive symptoms, anxiety symptoms, even psychosis. They can come talking to themselves, talking as if they're seeing strange things that others are not seeing. So they start misbehaving, their personality is changing. Some will start behaving silly, they start stripping, or some can just start getting very angry, very
Mm,
irritable. But when you see that this is not their usual, this is not what, and this is not normal, then you know that and the person is, a senior, and the person is forgetting things. Those are the, warning signs, and it is not witchcraft. Dementia is not witchcraft, okay? Now, so this stigma are the things that will now impact help seeking. They will not come. And then the caregivers now, because they are not coming out to say that, oh, they're experiencing this, they'll be born out. Yes, they'll be born out, they'll be
right.
tired. Because when it comes to managing dementia, we also understand how important their caregivers are. We care for the caregivers. We check their blood pressures and all that because it's very difficult. And this is something that they're going to kind of live with forever, with their relative. And the caregivers experience shame and then financial stress, especially when there's no
Mm,
external support. And then there's emotional exhaustion, like I said. Another thing that our patients experience is elder abuse. People start abusing. When I say elder abuse, it could be physical abuse. Some people start beating them. Even the relatives, the
oh,
caregivers,
wow.
verbal abuse. So some will just neglect them and lock them because it's tiring. Or because they can start soiling the house with feces, urine, and all that because they don't know. They miss their way around the house. A patient can just go to the kitchen and put there. So it's frustrating and it's highly different, and it's highly it's exhaustive for their caregivers. So
Mm,
so we need to reduce the stigma, and I'm really happy with Smooth FM for doing this, because the first thing with breaking a stigma and all this thing is the education. It's the education. I'm happy that people are calling in, as this makes me feel so glad. We have to keep doing this. We have to keep telling them everywhere that
yes, indeed.
dementia is not a spiritual attack or witchcraft. It is some things that elderly people can experience.
Mm. Dementia is not witchcraft. It's not village people. It's just something that elderly people can actually experience. That's why we have these discussions to, should I say, shed more light on it and give better understanding. We'll take another break, and then when we come back in, we'll begin to talk about the possibilities where diagnosis is concerned, treatment options, and all that, and begin to wrap up on the conversation. Don't go anywhere, Lagos. It's getting very, very interesting. This is Lagos Talks on Smooth 98.1. We'll be back in a moment. Ah, Interesting, interesting, interesting. Yes, indeed. You are listening to the Smooth Breakfast on Smooth 98.1, your love music, love live station. It's 31 minutes past 9 a.m. Ayokunmii here. It is a beautiful Monday morning. Looks like the rains have stopped at the moment. And I just hope the weather can just stay overcast the entire day. We don't want any heat. Yes, overcast weather and everything cool. That's what we actually want. Anyways, this is your home of great conversation and great conversation we have been having thus far up until this point. It's been about understanding dementia. And my guest, Dr. Busayo Fagbo, has been giving us all the necessary information, the knowledge that we need. It's been a beautiful one. And I hope we've been taking one or two things from the discussion this morning. You can also get in on the conversation. Let me know, let us know if you've had any experiences with anyone who has been living with dementia or any questions that you might want to ask because uh, this is an avenue for you to get the correct information. It is very, very important to have the correct information about anything and everything, really. So 0809 444 0981 is the WhatsApp number. You can send your messages there. Messages only at this time. YouTube, we're streaming live at Smooth 981 FM Lagos. Smooth 981 FM Lagos. You can leave your comments in the chat box there as well. All right, Dr. Busaya, let's talk about early diagnosis. Let's talk about treatment, really. When families suspect, oh, maybe this could be dementia, what exactly should they do? What's the next step? And realistically, given our healthcare system here in Nigeria, we know how fantastic in quotes it is. What options for treatment are even available, or even medication and so on?
All right, thank you very much, Ayokunmii. All right, when you start noticing that a family member, friend, church member, or someone really close to you, even a spouse, is having symptoms of dementia, like we've highlighted, the first thing is for you not to panic. Don't panic because usually when you're panicking and you're restless, you begin to take wrong decisions. The first thing is to seek medical evaluation early. Seek medical evaluation early. The management of dementia is multidisciplinary. The neurologist, the psychiatrist, and even depends on where you are. Even if you're in a primary health care center, just go to the hospital first and see the doctor there. Of course, a doctor will be able to say, okay, this is dementia, and they will refer you, appropriately, because the treatment gap, it's a major issue also in low and middle income countries like Nigeria, and because of the cost of healthcare, this out of pocket thing is really another thing that that makes people go to seek the traditional healers, or they go via the religious route. And the funny thing is that they would now have spent so much on that. By
Mm,
the time they are getting the care that they need, they're already exhausted financially. Financial burden is high. So the first thing is to go to the hospital, Federal
okay.
Neuropsychiatric Hospital. Yeah, but we have government hospitals in Lagos here. Luth, Lagos University Teaching Hospital, last week Lagos State. And if you don't want, the government hospitals, there are private facilities that you can check, like Mind Bob Health Clinic. And because when it comes to dementia, we don't admit them. Because when I'm talking about when we're talking about the care per se, dementia, we rarely admit them. Only in very few cases, because they do well in a familiar environment. They do well in a familiar
Okay.
environment. So home care, private facilities, like I was explaining that, like Mr. Ayokunmii was saying that I have Mind Bob Health Clinic, health and psychiatric facility, where we're actually leveraging more on the virtual care. We're talking about the virtual care and home visit, talking about the traffic and issues with Lagos. We come into, other government authorities. So you can go to private facilities if you can afford them, and then you can also leverage on virtual consultations, which we also do on Mind Bob Health. You can always, get the details on my Instagram, Dr. Busayo Mind Bob. Details are there. You can call in, and there are other private facilities that you can check. However, you can go to the teaching hospitals, especially because as I said, it's multidisciplinary. You want to see the neurologists, the psychiatrists, and even like I said, you can also see the general practitioners. You can go to the primary care.
Okay.
At least go to the doctor. Now, like I said, dementia doesn't have like a cure. Like acute illnesses like malaria and all that. But once everything is good when you pick the signs early. There are a lot of instruments that can be used to start saying, okay, is this mild? Because there's mild dementia, there's moderate, there's severe. And the earlier the better, because many things can be treatable. Take, for instance, someone that, like I told you, the modifiable risk factors for dementia. When we know, oh, this person is having poorly controlled blood pressure, so let's manage all those things. Stop smoking, stop taking, we'll be able, each patient, we individualize them, look at the risks that they have, advise and counsel appropriately. Or if this patient has, other psychiatric conditions with this, we treat. If patient has thyroid problems or vitamin deficiencies, we treat.
Okay.
If the patient has, you understand? So by the time, because we also we do the brain scan for patients with dementia, which is very important. So these are things. So there are drugs that we give that will reduce and slow down the progression. And then there are other, because we're looking more at the you know, medication, non-pharmacotherapeutic treatments. Talk about environmental stimulation. People are talking
Mm,
about music therapy in dementia now, heart therapy, bright light therapy. A lot of things are coming up now that we can help. Because when you have patients with dementia, you have to do more of, we have to really, really, because we have to educate the family, the caregivers on what they can do. You need to do things like labeling, because like I said, the issue with the forgetfulness. So you have to label each places with diagrams. That will help them
mm,
so that they don't miss their way around the house. You have to be
very
gentle with them
important.
because they have various symptoms. They can have this what we call catastrophic reaction. It's bad. It becomes because for some of them they have some moments where they can remember some things, and it gets so frustrating for them that they start getting very angry. Not because it's just, and this is stemming from the fact that they can't communicate with you. It's more like tantrums, you know. And so we need to
Right.
really educate the family so that they won't, because like I told you earlier, that people start beating them, physical abuse, saying mama is stubborn. No. So this, like, and another thing that this would do, coming to the facilities, saying the doctors, is that this consistent speaking with you, the caregivers, it will reduce caregiver stress and burnout. And then we also do things like coaching the caregiver. We do that in Mind Bob. We do caregiver coaching. Then we have, I don't know if there are some in Nigeria, where we have these respite services for the care, where they can, like a daycare, when they want to rest, just put them in a daycare, or invite people to come stay with them. These are things that we can look into when it comes
All
to
right.
management and treatment of dementia.
Mm, very, very well said there, Dr. Busayo. Okay, so as we wrap up the conversation, because we need to uh, rush through these last couple of these about 2 minutes right here. Just want to ask you, looking ahead, what gives you hope about dementia care right here in Nigeria? I mean, from your experiences, and can we, should I say, can we expect to see or to experience a difference going forward? Looking at, people like you, looking at what you do with MindBubble, so on and so forth. Is the future bright for dementia care looking ahead in Nigeria?
Yeah, thank you, Mr. Ayokunmii. That's a very powerful way to end this conversation. Of course, there's hope. Technology is advancing. Like what you're doing now, if we continue, like the first thing is the growing awareness and advocacy, via all this social media. People are on their phones, people are on social media now, and people are getting more knowledge. More Nigerians are beginning to recognize that dementia is a medical condition, not just old age wahala or spiritual attacks. Like I said, organizations like, Mindbob, Money, some foundations for dementia, even in Nigeria, you know, when we keep talking and people are listening, the perception about these things shift, you know. And then the good thing is that people are now, doing more
Mm,
when it comes to dementia. There are more research and all that. So another thing we can also do is the pathway to care. We can now start talking in churches. These things you move from not just the radio to the churches to
All
the
right.
smaller communities, community outreaches, even the spiritual homes, because hope lives where faith meets informed care.
Yes,
That's the
indeed.
truth. Right?
Yes,
And then
indeed.
I'm so happy about the rising, young tech minds in Nigeria. Because when it comes to managing dementia, we can also use tech stuffs, mobile apps, and even these things that we're doing, like the virtual consultation, support groups for the caregivers. Those things are also very good, and these are things that technology can help facilitate. Health professionals, they are getting more, education, and
Indeed. Indeed.
yes.
Indeed.
So
Oh,
you want me to keep talking?
I actually
I
want to take a message so we can wrap up on the conversation
All
because
right,
time
take
has
it.
absolutely flown by. This is
Okay.
Dakpo. Dakpo in Chester Terrace says, we thank God and it is well because age is a major factor which determines the dementia level in one's life. No man was created an island that, as rightfully stated, interaction is essential and necessary. The very first man who he named Adamu wasn't deficient of Evelyn's company, Adam and Eve there. What is fed into the various five senses is of vital importance, and negativity begets negativity. Talking about stomach, diet, and longevity. Metusela's generation were basically feeding on farm fresh products and not all the chemicals we are daily injecting into our system these days. I just had to summarize his message there. Thank you very much, Dakwa, for sending that message in. And it has been a pleasure having you on the show this morning, Dr. Busayo Fagbo. It has been a very insightful one. For those who want to talk to you on social media, just reach out to you on social media, specifically your Instagram and co. Where can they find you? What's your handle there? They can find you and send you a DM.
Oh, okay. So I'm on Instagram, I'm on Facebook, and on TikTok. So on Instagram, it's Dr. Busayo Mindbulb on Instagram.
Okay.
So I'm sure there should be a link or something that will direct them to maybe
To
a
the
place to
others.
chat. Yes, so you can always send a DM on that. And then on Facebook, I'm Busayo Fagbo. So you can send me a direct message on Facebook and then we can go from there. Member of
All
the
right.
team, we communicate. So we can always go from there. Dr.
Fantastic. Thank you
Busayo
so much,
Mindbulb. Thank you so
Dr.
much.
Busayo Mindbulb. Thank you
Then
so very
Busayo
much.
Fagbo on Facebook.
All right, then. Thank you so very much for taking the time out. I really appreciate it. We should do more
Thank
of
you,
these
Ayokunmii.
sort of shows. Very,
Yes,
very important. All right. Have a
yes.
great Monday and great rest of the week
Oh, have a
as
better
well.
one. Enjoy yourself, Lagos.
Indeed.
Bye.
All right, then. Lagos, it's been a thrill. Thank you so much for being a part of the show. Do not go anywhere. No, no, no. There's so much more to come on the Smooth Breakfast. In a couple of minutes, I'll be having a conversation about the Smart Trader Summit. If you want to know what that is all about, you need to keep it tuned and don't go anywhere.